Bună ziua! Înainte de a trece la engleză, aș vrea să mulțumesc pentru invitația de a participa la acest important și special eveniment al centenarului Institutului Național Cantacuzino. Mulțumiri speciale domnului profesor Mircea Ioan Popa pentru invitație și sunt emoționat și onorat să iau parte la acest eveniment împreună cu dumneavoastră. The topic of my lecture today is COVID immunization, the experience of Israel, and what I would like to do is to share with you different aspects of the epidemic and also the immunization campaign carried out in Israel recently. And this is the burden of disease all over the world. To date, more than 127 million confirmed cases of corona, of COVID-19, including more than 2 million, almost 3 million deaths reported to WHO, with an excess of morbidity and mortality in the European and American regions of WHO. And a few words of Israel, where I will be the background for my presentation. Today, Israel has a population of more than 9 million citizens, with Jews representing about 80% of the population, and with Israeli Arabs, which represent about 20-21% of the general population. The Orthodox Jews, the religious Orthodox Jews in Israel represent about 12% of the population, and I mentioned them because they actually were significantly affected by the epidemic. In terms of healthcare system in Israel, again, background regarding the pandemic itself and the vaccination campaign. The Ministry of Health is the main regulator, and we have a universal health insurance, a basket of universal health services, which are delivered to the population by four health maintenance organizations. These the HMOs, which include the primary prevention, the outpatient services, laboratories, hospitals. Most of the hospitals are public hospitals. And there is a national wide spread of clinics and hospitals. Important to mention that we have a good electronic health system of records, and this is for the last 5 years. And this is an important piece of information regarding the SARS-CoV-2 PCR testing in Israel. And this is actually the natural history, I would say, of testing from the beginning of March 2020 up to March 2021. And this is the evolution of the testing with very limited capabilities in the beginning of the epidemic, and then the expansion of the laboratory capacities and more tests, reaching actually the level of about hundreds of thousands of tests daily. Altogether, more than almost actually 11 million tests carried out during the last year of the COVID-19 epidemic in Israel. A lot of the beginning, a lot of tests with the indication to be carried out just in symptomatic cases of disease, but later on extended to screening campaigns, including a lot of screening in nursing homes, especially the healthcare workers, giving the health services to the old people at high risk of COVID-19 disease and fatality. And this is actually the epidemic curve of the incidence with cases per 100,000 in Israel from March 2020 up to date, with 3 waves of disease and epidemic waves of peaks of disease, and followed by lockdowns, and altogether more than 800,000 confirmed PCR confirmed cases of COVID-19, and with an important date of December 19, 2020, when the immunization campaign started in Israel, and we'll come to this point later on. And following the same pattern of morbidity, also the severe disease, the severe morbidity due to SARS-CoV-2, and these are the hospitalized severe cases, the same pattern of following the waves of disease, and these are the deaths, almost now today more than 6,000 deaths caused by SARS-CoV-2, with similar and parallel waves of mortality. And this is the distribution actually of the incidence of disease according to the age groups, with an excess of morbidity in the younger age groups, 10 to 29 years of age. On the other side, there is the mortality with the highest rates in older people from 60 to up, with the highest mortality in those aged 70 and more, and an excess in males as compared to females. An interesting also correlate of morbidity and is there was the low socioeconomic status, crowding the specific risk factors, and crowding especially characteristic to ultra-Orthodox Jewish communities or to Israeli Arab villages was the risk factors with the highest morbidity here. And these were also the populations with the lower compliance or lower uptake of diagnostic tests. And again, disparities related, associated with the socioeconomic status of specific groups in Israel. And this is the map of Israel with the foci of morbidity of COVID-19. Again, these special towns with the cumulative incidence in excess, the foci of the epidemic. But what is clear is that these classes of disease have been dispersed along all over the country. Under this situation and along the months of 2020, the Ministry of Health and the government had actually contacts with the various manufacturers of candidate vaccines against corona, especially with those making the mRNA vaccines, with Pfizer, with Moderna, and also with Oxford AstraZeneca, which who are making actually the vaccine based on adenovirus as a viral vector, but also encoding for genes, including genes encoding for the spike antigen, the protective antigen of the virus. And also in Israel, there is a development which reached phase 1 and phase 2 trials in humans of a vaccine based on another viral vector. This is the VZV, the vesicular stomatitis virus, engineered to carry the genes also for the S antigen. And the dialogues with these big pharma, and especially with Pfizer, intensified after the results of the phase 3 study of Pfizer, which showed 94% of vaccine efficacy and the good safety profile, and especially after the FDA released the emergency use authority to this vaccine. And indeed, on December 19, 2020, the campaign of vaccination with the Pfizer vaccine started, having the Prime Minister the first vaccinee, and then actually little by little the vaccine started to be given in a mass vaccination approach, 2 doses, 21 days apart, free of charge, voluntarily, using actually the HMO clinics spread all over the country to deliver the vaccine, but also mobile immunization stations, a lot of vaccination in nursing homes, and initially as priorities, target groups were healthcare workers and citizens aged 60 or older, and those having underlying diseases. And currently, actually, vaccination has been extended to all those being older than 16 years of age. Vaccination is also offered to recoveries, to people who recovered from PCR confirmed disease or infection, and they receive 1 dose of vaccination. And today, fortunately, we are in a good situation in which more than half of the Israeli population has been vaccinated with 2 doses of the vaccine. We are leading, we are leading the world in terms of coverage of the vaccine, the uptake of this mRNA vaccine. This slide shows that the best uptake of the vaccine is in the older age groups, between 80 or more than 80 up to almost 100%, and much less in the younger age groups. And again, if we look at socioeconomic status, compliance or uptake of vaccine is actually low in those actually who need more the vaccine, where the morbidity was in excess. This situation in which we have the opportunity to have such a large campaign of vaccination gives the opportunity to get information on the effectiveness of vaccination of this vaccine, on the performance of the vaccine in the real world, not just under the conditions of the clinical trial. And this is important for Israel, it's important for Pfizer, it's important for all the planet to know from our experience. So real world means what is the vaccine performance across diverse populations with a wide range of coexisting conditions. It is under the conditions of imperfect adherence to vaccination protocols, with the challenges of the cold chain maintenance, which is so characteristic to the Pfizer vaccine, and with all the vaccine deployment logistics. And here are the first effectiveness data that we had after even vaccination with the first dose of the vaccine. Different publications were released, and they show that even after one dose, the vaccine showed after 14 days following vaccination, 13 days following the first injection, the vaccine showed the signal of protection reaching 51% in this big cohort of an HMO, the Maccabi HMO in Israel. And in a controlled trial in healthcare workers, similar results, a bit higher, 75% protective efficacy just after one dose of vaccine. And a recent study published in the New England Journal of Medicine, now with data coming from the largest HMO in Israel, the Clalit HMO, shows the effectiveness of this vaccine after 2 doses delivered to vaccinees, and as compared to a cohort of unvaccinated people. Almost 600,000 vaccinees and non-vaccinees have been followed up, and we have already these effectiveness data 7 days after the second dose of the vaccine, and there were a few outcomes that were studied, documenting infection. symptomatic illness, hospitalization, severe disease, and death. And here are the level of effectiveness shown by the vaccine. 92 protective efficacy of vaccine effectiveness against all infections, SARS, both symptomatic and asymptomatic, a bit higher against symptomatic disease, 78% efficacy against hospitalizations, and severe disease more than 90%. So these were, of course, these are encouraging data, also supported by further data received on the national, I would say, level by the surveillance of the Ministry of Health, looking at the whole population of the cohorts receiving the vaccine as compared to those who did not receive the vaccine. And in this case, also 7 days as was the follow-up, 7 days after the second dose, and also 14 days after the second dose. With all the adjustments actually needed in order to control for potential confounders, but altogether the level of effectiveness was very good against actually all the outcomes, all the various outcomes, such as overall SARS infection, symptomatic infection, hospitalization, and the fatalities. And here are the level of effectiveness after 2 weeks after the second dose, which are even better than those observed 7 days after the second dose. Just to mention that these effectiveness data are observed when the British variant with improved or enhanced infectious effectiveness and transmission by about 50% is prevalent in Israel at a rate of about 90% of the isolates of SARS-CoV-2 isolates. And these are the first data on the impact of vaccination here in terms of the reduction of prevalence of severe cases of COVID-19 after vaccination, and here in terms of a reduction in death, in mortality following infection with SARS-CoV-2. And these are also important findings, recent findings on already the impact of vaccination, nationwide impact, and the relationship between the extent of coverage at the various age groups which got the vaccine and the degree of reduction in the incidence of the disease of COVID-19. The highest this age group, the highest the coverage with one dose or 2 doses. I would say the deepest is the reduction in the attack rate and the incidence of disease. Here a little bit less coverage, a good reduction, but less than in the highest age groups, and low reduction, low coverage, and low reduction when we go down in terms of age groups. And these are data recently published in Lancet journal. And just to conclude and to mention some challenges, we can say that 2 doses of the Pfizer vaccine were highly effective in preventing laboratory confirmed SARS-CoV infections and COVID-19 hospitalization and death. There is evidence of nationwide impact of vaccination. In terms of challenges, I would say that we have to increase the vaccine uptake in young age groups, in Arabs and ultra-Orthodox Jews, and positive incentives and education and addressing fake news are recommended. There is a need for a continuing evaluation of performance of the vaccine in real life, including assessment of indirect protection and duration of protection. Let's see what if there will be also a decrease in the incidence of the disease in children up to the age of 16 who are not vaccinated. And it's important to follow and to see if the new variants, which are still rare in Israel, the South African and the Brazilian variant, if they won't be associated, if there will be an increase in their relative importance in Israel, won't be associated with the reduction in the effectiveness of the vaccine. And I want to acknowledge the support of my team at Tel Aviv University, my colleagues, and finally, just to say that in memoriam, I would like that prezentarea mea să o dedic memoriei medicilor, microbiologi, evrei educației în România, care și-au adus aportul la dezvoltarea și înflorirea Institutului COHEN Cantacuzino și au fost, după imigrarea în Israel, lideri ai microbiologiei clinice și de cercetare în Israel. Și pe o parte din dumnealor am avut ocazia să-i cunosc. Vă mulțumesc!